Okay, so let's start again from the starting. I was just telling you that a major portion or a major aspect of the management of patient is the medication management. Specifically, most of the OPD treatment that we are providing to a patient is entirely or to a large extent is basically prescribing a medicine. However, in the indoor, in surgical areas, we are doing the surgery. But for medical part, even in the surgical wards, we are giving a different in various types of medications. Those medications could be IV medications, oral medications, or in some other form. So managing the safety of those medications, specifically within the four walls of the hospital, is the responsibility of the administrator. From procurement, ensuring that we are procuring quality medicine, its storage, its transportation, training of the staff, or administration, proper administration, identification. And if something goes wrong, then it's proper addressing those reasons and then preventing it further is very important from our perspective. So I'll start with a few slides, true stories that actually had happened. Here you can see one of the kid was actually died from after it was alleged that it is because of a wrong injection. Whether it was true or not, it could have been ascertained only later on. But this was an allegation. Similarly, you must have heard many times it happens in earlier in eye camps when there was time eye camps used to happen, whether because of the infection or because of some mismanagement of medication. There used to be cases of some issues related to the safety of those procedures. So, but these are not isolated incidents, and these do actually occur sometimes in the larger establishments where better protocols are being followed. Sometimes it is the human error also, right? See, it's not because they wanted to do it, but because of the workload and many other aspects. Sometimes it is a human error where medication error actually happens. For example, in this case, the drug was to be, added in one type of solution, whereas it was inadvertently added to a different type of solution. So it led to precipitation of the drug. Although the drug was not administered, but it was wasted because the drug was supposed to be mixed in one type of a solution and it was actually mixed in a different type of solution. It leads, and the drug was actually very costly. It was in lakhs. That's why this became a huge issue. So this background, I will try to share with you my perspective on what the medication management is. What are the things that as an administrator we should ensure in our setups in our hospitals. So what is medication management? It is basically doing things right, and there's not one thing that we have to do right. There are multiples of things that we have to be right. It starts with the right item. The right item is the item which is of right quality, right? And many times it is beyond our control, but not always. We can have the protocols, follow the standards, and procure in a way which ensures that the drugs that we are procuring in our hospital are quality drugs, while following the government guidelines also. Then the right quantity. Why it is important? The right quantity is important because if do not have enough quantity of drugs, it will lead to the stock out situations, and the stock out situations specifically for the life-saving or critical drugs could lead to detrimental consequences. If we have more quantity than what is required for our annual demand or for 2 years demand, then it will lead to the expiry of the drug, and then again it is not a good situation. Right form, the form in which we want. If I want an oral solution of a drug for a pediatric age group, that is what I need. I cannot give a pediatric age group a tablet form even if the drug is same. So having a right form, whether it is an IV form or a patch or a capsule or oral or a liquid form, that right form has to be there. Then it has to be administered from a right route, right? An IM drug cannot be administered IV many times. It will lead to problem, right? So that route has to be right at the right time. I mean, uh, if it has to be given 3 times in a day, we have to ensure that the gap between two doses is 8 hours. If it leads to a gap of 16 hours, then the concentration in the blood would reduce. And by mistake, if the gap between the two injections or doses is less, then it also leads to some problem. For example, if it is an insulin and if it is to be given once in 24 hours, and if we give it, let's say, twice in 24 hours, then it could lead to a situation of hypoglycemia. Right frequency, as I mentioned, right patient also, right? It is more often than not, it happens that the same patients with same name are admitted in the same cubicle. Always make sure, if in your ward, especially it is for the nurses, that if you have 2 patients and they have same first name, make sure that they are under the care of different nurses. So shift them to different cubicle, which is being managed by a different nurse. So there is no even remotest chance of mismanaging either surgery or dose or drug or something. So right storage is very important, and it specifically is important for the heat labile drugs, which are to be stored in refrigeration. Many IV fluids you have to store properly, because in IV fluids, what happens during transportation or storage, if proper storage is not there, it leads to some types of micro punctures which will not be visible to you, and there will not be visible leakage. But those micro punctures actually lead to the growth of fungus. And you must have heard many times newspapers that patients complained, some particulate matter or fungus in the IV fluid. Then right labeling, and it is, let me tell you, an offense under the Drug and Cosmetics Act also. If it is not labeled properly, even if the Indian pharmacopoeia is not written, IP is not written, and there have been instances where penalties have also been imposed on the drug companies. Now, from the administrator's perspective, I want the drug, but I want it at the right price. Right? Because my resources are, specifically my money is not infinite, it is finite. I want best use of my money and resources. So I want that it has, the price has to be reasonable. And so I have to, without compromising on the quality, I need to ensure that the price that I'm paying is the right price. And then I'm purchasing it from the right source. Now, right source has to be a credible source. But sometimes we also have to look from the perspective whether it is an Indian or a foreigner, whether there will be an uninterrupted supply chain, or I'll have to face problems. Maybe once they might supply, and then for the next, they are dependent on something, import permits or something. So a right source is one which is credible, reliable, consistent, and in the past, which has not created problems for me. If a supplier in the past has created problems for me, my trust goes down, and then I'll have to look for the, some other source. Now, all this have to happen. If all this has to happen, this is not going to happen in thin air. It has to be. It will happen in a system. So developing the right system with the right people and the right kind of an infrastructure is important. And especially in medication management, the role of the hospital information system is very big. This can actually prevent many of the problems of the medication. For example, when we are prescribing and writing in our handwriting, the handwriting could be, pathetic sometimes, which could lead to the medication errors. Similarly, drug-drug interactions can happen, but if you are prescribing online in the HIS, those drug-drug interactions can be identified by the HIS, and it will tell you, okay, Dr. Saab, you are prescribing this medicine, and with this medicine, there is a known drug-drug interaction. Do you want to continue or not? So a right system could actually provide you, take care of all that I'm mentioning that have to be right. Then the right approach to the medication management is important. That the understanding that despite all these things, errors can still happen. And if your approach to errors is to blame people or to point fingers, then over the period what will happen, people will not be forthcoming to tell you if something goes wrong. And if they don't tell you, the system will not improve. To make the system better, the first requirement is that you acknowledge that something has happened. And if there is some punitive action required based on maybe if it is totally negligent behavior is there, that's a different thing. But if it is a genuine error that has happened, then the right approach is to see it from the system's perspective rather than from an individual's perspective. And giving the training to the people for this. When we are saying it has to be administered correctly, it has to be stored correctly, that type of a training to the concerned staff, both the nurses and the pharmacists, and the residents also, and your consultants is from time to time is important. Now, I mentioned that medication management is important, but some of you might be aware this landmark publication to err is human, which was published by the Institute of Medicine. And it said that the medication error is a major cause of preventable patient harm in the hospital. 1 in 10 patient is harmed while receiving hospital care in developed countries. And there are estimates now that in the developing countries, this number is higher. And it is also applicable to the infections also. It's not just the medication error that we are talking in infection cases also, because in most of the hospitals in this country and in most of the developing countries, we do not measure the rate of the hospital-acquired infection. 1 death every day and injure approximately 1.3 million people annually in USA alone. And the cost associated with the medication error has been estimated at US dollars 42 billion annually. And this is an old data. So that is why it is important. And the human life, you can't put a cost on the human life. Every life lost or every productive day lost because of the hospital admission costs a lot. So human life is precious. You just cannot put a price on that. So saving every life is our goal, and we don't want that anyone who is being admitted in hospital faces a situation of medication errors. So what is medication error? It's a failure in the treatment process that leads to or has the potential to lead to harm to the patient. And any preventable event that may cause or lead to inappropriate medication use or patient harm. That is the definition. Now let's understand how it is different from the adverse drug reactions. Adverse drug reactions keep happening. So the adverse drug reaction may be preventable, usually the result of an error. So the medication error is a component of adverse drug reaction. But not all adverse drug reactions are preventable. For example, if you have been given, let's say, a vaccine, there are chances you may have a erythema at the site or some itching at the site or even fever, which are the known, side effects. So those adverse drug reactions or adverse drug events are not preventable and are known, right? Whereas a medication error may result in an adverse event if a patient is harmed, a near miss if a patient is nearly harmed. For example, in the case I shared where the drug was mixed in a different solution, it was a medication error because the mixing was in a wrong solution, but it was a near miss because that was visible that the precipitation has happened in the solution and it was not administered. It may go unnoticed also, neither harm nor potential for the harm. But medication errors are preventable, right? They are not known side effects of the medication. So these are something has gone amiss. It could be a human error or a system error or a negligence. So in that perspective, medication errors are preventable. where these medication errors can happen, right? So it could happen at the prescription level. And if, let's say, in many of the West, many hospital transcribers are there, they transcribe the drug. It could happen at the dispensing level, administration's level, or during the monitoring, some medication error also happen. So the medication problem subcategory could be you have given the right drug but to a wrong patient, or a right patient but a wrong medicine, or a wrong dose, or strength or frequency is not right, the formulation is not correct, either route is not correct, quantity is not correct, right? To a pediatric patient, you have given an adult dose, right? Or even to an adult, you have given a pediatric dose, then he is not, getting treated. That is also extending his ailment. Wrong storage, omitted medicines, that is also a medication error. Not administering the drug which was supposed to be administered at a time. So it is both, an act of commission or an act of omission. Both can lead to medication error. Or a drug, even if it does not cause any harm, because it is expired, there is chances that the potency of the drug has gone down, and it would not lead to the desired outcome that you want. So these are some of the subcategories of the problems. Now, there could be many contributing factors. It's not straightforward. As I said, this is always a systems point of view we should look at it. So what could be the medication safety risks, or things that actually lead to the medication safety risk? So there are patient factors, clinical condition, physical factors, social factors, psychological or mental factors, or interpersonal relationship that also leads to medication errors. And when we are talking of the patient factors, this mainly we are talking when the patient himself is taking a medication at home. So these factors might lead to some type of a medication error at the patient's end. When the staff factors, again, physical issues, psychological, social, domestic, personality, or cognitive factors. Task factors could be not following proper guidelines, procedures, protocols, or not having those guidelines in first place. Decision aids, task design, communication factors, very important, especially in the drugs. It could be verbal communication or a written communication also. If proper verbal or written communication of the drugs does not happen, it leads to disasters. Verbal, written, non-verbal management of the drugs. Team factors, role congruence, leadership, support, cultural factors, and last time, as I mentioned, when the shift change happens, when we are handing over the patients from one nurse to another, it is a very critical time where everything should be, described or told about the patients, or any new event that has happened, or new drug that has been added during that shift. Then education or lack of education, training, factors related to competence, supervision, availability and accessibility and appropriateness. Now, for example, if there is not enough storage space available to the nurse in the ward, then she might try to store it in a condition which is not the optimal one. So that has to be looked into, that if the ward is big, the demand for drugs is higher, and the storage is not commensurate to the requirement, then it could lead to a problem. Then equipment plus resources, displaying integrity, positioning, usability, working conditions factors, design of the physical environment, even the illumination is very important, right? Staffing pattern, workload and hours, time, organizational factors, strategic factors, organizational structure, priorities, externally imported risks or safety cultures. These are all contributing factors, and no doubt there are individual factors many a times which lead to the individual negligence or some type of an error. But we should see it at a larger perspective, that why those individual factors are happening, and why at a systemic level we were not able to prevent, even if there were some individual factors. So at prescribing level, what can happen that inadequate knowledge about drug indications and the contraindications, not considering individual patient factors such as their allergies, whether the patient is pregnant, whether it have some comorbidity and other medications. Then you have prescribed it to a wrong patient. You went to the, you're taking the round, you are a resident. You mentioned you had all the, files with you. You wanted to mention it to patient A, whereas you mentioned in the file of patient B. When the sister came, she saw this is to be administered and that drug was administered. Then at prescribing wrong dose, wrong time, wrong drug, wrong route, inadequate communication, documentation is illegible, incomplete, or ambiguous documentation. Mathematical error while calculating the doses, and especially we have to be extra careful during if we are prescribing it to the pediatric age group or geriatric age group, or for the drugs for which the therapeutic index is very narrow. For example, there are drugs which can be administered only in a range of their doses. For example, lithium is one which is given to the psychiatric drugs. Its therapeutic index is very, very narrow. So any dose beyond that range could lead to problems. Then incorrect data entry when using computerized prescribing, for example, duplication, omission, or a wrong. Lookalike, sound-alike drugs. This is a big problem, more than we anticipate. And I was a member of one of the WHO's working group on it. We have published a publication, and I'll show you how big this problem is. Now, for example, you want to give alprazolam, which comes with the 0.5 mg dose. You could give it to the omeprazole, because the alprazole is actually just it's a difference of L and D, and adprazole is actually an omeprazole in the market. Similarly, MSAT and MSAT. MSAT is basically with A is basically ampicillin, cloxacillin combination, whereas MSAT with E is actually an amlodipine 5 mg, which is entirely a different drug. One is an antibiotic, and other one is for the hypertension. So this was the publication I was part of, and you can actually have a look. WHO's published it during one of the patient safety days. I think it was 4 or 5 years ago, or maybe more, when the medication safety for lookalike, sound-alike drug medicines was published. What are the various known causes of lookalike, sound-alike errors during prescribing? Illegible or poorly legible prescription, and the handwriting of doctors. They are notorious for being illegible. Incorrect selection of medicine from drop-down menus in the computer. Even if you are using computer and you are not vigilant enough, you have not clicked the correct drug. You just clicked one drug above or one drug below. So that could also lead to a problem. Verbal and telephone orders for medications are another causes for the LASA. Inappropriate use of error-prone abbreviations. You thought abbreviation is for this drug, whereas someone else may think that this is some other drug. So better avoid abbreviations while prescribing the drugs. Use of a trailing 0.0 mg can be interpreted as 50 mg. So better to avoid this. And not using the 0 before point could lead to interpretation of a 5 mg. So it is better to write 0.5 mg rather than just writing 0.5 mg. Other causes are during dispensing, storage of LASA medicines on the same shelf next to each other. It's a very big, because many times what nurses do, they will try to arrange it in an alphabetic order. And when they're arranging it in alphabetic orders, the same drugs starting with the same alphabet might be placed next to each other. So this should be avoided. During administration could happen unclear instructions, for example, as directed, leaving instructions open to misinterpretation. That should be clear. This much of dose, this many times, this should be the route. And selection of a product according to familiarity with the packaging or strength. Packages could look same, same form of a tablet or an injectable with almost same color of labeling could lead to a problem when they are placed next to each other, or if they are placed in the same cart. Now, it could happen, this was at the prescribing stage. It could happen while dispensing or administration also. So always double check while you're dispensing. For pharmacists, I always say, when you are handing over to the patient or to the ward aide or ward hospital attendant who has come to collect the drugs, always double check before you are handing it over. So it could be you have given it to wrong patient, wrong route, wrong time, wrong dose, wrong drug. Omission or inadequate documentation can also be a problem. Monitoring, the medication side effects may happen during and at the after, will obviously happen after the drug has been administered. So lack of monitoring for side effects, drug not seized if not working or course completed, drug seized before course completed, drug levels not measured or not followed up, or there is the communication failure during the monitoring stage. Now, there are some high-risk patients. When we are prescribing or administering drugs to such patients, we have to be extra careful. Multi-pharmacy, so patients who are on multiple medications, and that also not from the same doctor, from different doctors. And sometimes patients are following multipathies also. They are taking drugs from allopathy, they are taking drugs from homeopathy, from Ayurveda, and there might be some drug-drug interaction at some stage. So always asking the patient that, okay, tell me what all the drugs you are on. Are there any other drugs for some other comorbidities that you are taking, or you are taking it from other doctor? Knowing that is very important. Patient with some comorbid conditions, renal impairment, hypertension, diabetes, and many others. Pregnancy, very, very important. There are some drugs entirely contraindicated in pregnancy because they can lead to different types of problems to both mother as well as the fetus as well. Thalidomide was a very notorious drug which is totally banned now in the world, but there was a time when it used to, use, and then it led to fetal abnormalities. The patients who cannot communicate well, right? Pediatric patients, patients with some psychiatric disorders, comatose patients, uh, patients who have difficulty in speaking, and many other patients because of their temporary ailment, they are temporarily not able to communicate well. The patients who have more than one doctor, always be careful. Patients who do not take an active role in their own medication use. Um, we live in a country where we trust the doctor, and majority of the people are not literate enough to understand. And many times doctors also, most of the time doctors also don't have time to explain everything to them. So what they do, they write it many times on the box of the drug. But then for even to read that, the patient has to be literate enough to read even in Hindi or in the vernacular language that has been written, that this drug has to be taken 2 times a day or 3 times a day, or before meal or after meal. So this adds another layer of complication which leads to the medication error. And children and babies, obviously, because the drug dose calculation has to be done, and some drugs are entirely banned from using uh, below a certain age limit. Then the provider related factors that which are related to the healthcare providers: inexperience, too much of workload. We are rushing, whether it is a pharmacist or a nurse or a resident or a doctor. If too much of patients, they are prescribing drugs. They in OPD, they have to see, let's say, 100 200 patients who are waiting outside their room, then they would probably rush. Doing multiple things at once, right? You are prescribing or advising the drugs, at the same time you are doing something else, or you are attending an online call or an online meeting, or something could lead to. Then there are, if interruptions are there, phone calls are there, you are prescribing something, you are doing something on HIS, and suddenly your attention get interrupted, could lead to problems. Fatigue, boredom, being on automatic pilot, leading to failure to check and double check. Lack of checking and double checking habits, and poor teamwork or just give me a moment. See, that is what I was saying, interruptions when you are doing something. So sorry for that. Uh, so poor teamwork and or communication between, colleagues. So the double checking, and specifically, as I mentioned earlier, during the shift change, it is very important. So what could be the preventive measures? Always use generic names, right? Because look-alike, sound-alike drugs are usually when we are using the branded names. Tailor prescribing for each patient, right? Know the high-risk medications and take precautions not only in prescribing but storing also. And narcotic drugs are always stored in a lock and key. So that is important that you always keep the narcotic drugs under lock and key. Communicate clearly. Don't hesitate to ask again if you have not understood. Develop checking habits, active patient involvement, report and learn from the errors, no blame culture, and education and training. So this is a very famous photograph. Many of you must be aware of it. It is called the Swiss cheese model. So Swiss cheese has multiple layers, and you can see that all these layers in patient safety or in any case of error, we tell them as the checks and balances. These layers are there for a reason. For example, in case of this medication safety, there are A, B, C, D, E. I mean, in 5 layers of safety. But if those all layers have some type of a defect, deficiency, negligence, then that has been depicted as a whole. And if all the holes are aligned and the failure happens at all the levels of checks and balances, then a medication error happens. If any one of the check and balance works well, the error can be prevented from happening, as it has been happened. You can see at the 4 levels it has passed, but at the at the E level it could have been prevented. So there are checks and balances. We must ensure that the checks and balances are there for a reason and people are following them and not bypassing them. This is a strategic framework for the global patient safety challenge, in which the medication without harm was one of the challenge. And there are 4 areas where it has been divided: healthcare professionals, medicines, systems and practices of medicine, and patients and the public. And everyone has a role. From the healthcare professionals point of view, education and training, communication and teamwork, capability at the point of care, and incident reporting and learning is to be done. From the pharmaceutical point of view, medicine, right product, logistics, storage, disposal, naming, labeling, packaging, product quality and safety ensuring is important. From our hospital administrators or healthcare administrators point of view, having a proper system for having the good leadership and governance, having the systems of prescribing, preparation, dispensing, administration, patient monitoring, and evaluation has to be there. And patient is an important stakeholder. So the public awareness about the medication and their literacy, their engagement, reporting by their patients whenever ADR happens or a medication error is happening. Let me tell you, I remember one incident long back. One of the attendant of the patient, after the drug was administered, actually told me that, Dr. Sahab, yesterday when the drug was administered in the IV bottle, the color was different. Today the color is different. Although he was an educated one, but many times even the uneducated patient can see that something is different than what was administered yesterday or in the morning, so they can actually tell, and they will only be able to tell this when they are empowered, when they have this feeling that if I say, it will not be taken otherwise. So that developing that culture is very important. Then this is the 5 moment of medication safety. This is also again one of the WHO's publication, where they have given, while you are starting a medicine or taking a medicine or adding a new medication in already treatment and the previous treatment plan, reviewing of the medicine when you are doing, or you are stopping a medication. These are the 5 things that you need to be, the 5 questions you should ask, right? Then there is this MedSafe app also, which is available on the App Store as well as on the Google play in Android, which can be downloaded and can be used by the common person whosoever is literate enough to use an app. Now, what are the barriers to the patient engagement? Why we are not able to engage one of the important stakeholder in when we are saying we want to develop this system? Patient is an important part of that system. We can spend a lot of energy on doing making systems right and training and doing education of the healthcare workers. A little bit we have to do on the patient side also, because patient is an important stakeholder. Now, the why we are not able to do in this country, education and literacy is one aspect which is a barrier. Then low socioeconomic strata, and with related to low socioeconomic strata is the poverty and illiteracy and many other related social issues. Then we have a complete trust in doctor, nurses, or authorities, and that's why we don't want to question that, right? Questioning is not wrong, as long as this is for the betterment of the patient. So we have to be, receptive also with respect to the patient's feedback. Lack of knowledge about their medications, reluctance to ask questions, as I mentioned, patients do not know what to ask, and doctors may not be receptive to questions also. Difficulty of reporting errors and adverse events. There are no systems where they can actually report it. No clear reporting channel. Patients don't know how to report it. Even educated ones, even if they know, if you have prescribed a drug, they are taking the drug for a week, and there is something they noticed, there is no proper way to report those type of errors. May not be an error, but an ADR. So these types of WHO publications, WHO had provided a few years ago for the education of the patient, and there are so many others which, if you want to display in the waiting halls of your in your language, whatever the local language is, you can have such type of posters in the waiting halls where patients can actually be made aware of medication safety. So that was all for the medication safety and management. If you have any questions before I start the transfusion services, you are welcome to ask.
Sir, the presentation was really beautiful. But one thing I want to know, you said 1 in 10 patients having the medications error in developed countries. So any data about the developed countries like us?
I'll have to check.
How many of them develop medication?
Yeah. Nowadays there is some data, but I have to check that. Yeah. Does the IGNOU manual have any data on that aspect? I'm not sure if you have checked that.
Actually, I did not read, sir.
Okay, no problem. I'll check and I'll get back.
Thank you, sir.
Yeah. Anyone else?
Sir, kindly share the PPT.
Yeah. I am sharing all the PPTs with the IGNOU headquarters, so they will be sharing with you.
Sir, I told you that examination is very near. So whether if they will share after the exam, that will not be of any value to us.
Is there someone from the RCD here? Yeah, there is RCD2 nodal, if they can clarify on this. Because it is beyond my control. I have no problem. I have already shared it with the headquarters. So
in fact, I'll tell you, sir. I requested Dr. Mehrotra sir also. He was our teacher during PGDHS days also. See, he keeps sharing with me what on the day-to-day basis. Okay. And then I share to our colleagues.
Okay, I have no problem.